Europe is currently gearing up for summer vacations after a long winter spent in lockdown. That's despite concerns about the spread of the Covid-19 Delta variant, which is considered more transmissible. But across the continent, football fans have been returning to bars and stadiums to watch the European Championship. While most countries have limited crowd sizes, Hungary is allowing full attendance without masks. Officials from the World Health Organization are warning against complacency. So let's bring in Dr. Hans Kluge. He is with the World Health Organization. He's the regional director for Europe. Dr. Kluge, you have warned that the new Delta variant is poised to take hold of Europe this summer. What's your main concern there?
Well, the fact that there is a fast spread of the Delta variant means that the virus still has the upper hand. So we have to be very careful with large mass gathering events, particularly if it's with the people without a mask, which still remains a hazard. For the time being, the map in Europe is much more better. It's positive. Cases, hospitalization, deaths are decreasing, but we are still not out of the woods. I do understand that no one wants to give up another summer, but we should not pay it with another re-locked winter.
Okay. You mentioned Hungary there. You mentioned the Euros. Is Hungary being reckless, or is the rest of us overcautious?
Well, I don't want to point out any country. Let's say as a principle that a uncontrolled ground opening of society is never a good idea. And we should learn the lesson from 1 year ago. Gradually, safe and a minimum of public health measures oversight.
So vaccinations, though, have shown to prevent serious illness. We are in a different situation than last year, aren't we?
Absolutely. The only issue is that there is too much inequity in access to vaccines, and no one is safe until everyone is safe. We need 11 billion doses in the next 12 months, which would cost $150 million a day, while the pandemic every day cost 100 times more. So we need strong leadership, and thank you to Germany for a very strong contribution to the COVAX facility.
Let's go back to the new variant. Even with travel restrictions, isn't it naive to believe that the Delta variant won't have already spread very quickly?
Absolutely. So that's why safe travel advisory measures remain very, very important, particularly at the main points of entry. I would say it doesn't mean people cannot travel, but travel safely. We know what helps, what needs to be done. What we need is that the vaccines are spreading faster than the mutants are spreading.
So experts are saying that Covid-19 in the long run will become endemic, which means that we're going to have to live with it. What will determine the point, you think, when we can get back to business as usual?
It's tricky to put a figure, but our experts in the WHO European region have the benchmark of 80%. If you have 30% of your population vaccinated, you start to stabilize. Do you have 60%? At that moment, you really protect. And at 80%, we can get out of it. So it's very important for the people. It's your turn. Please show up and take the 2 doses.
Are you worried about vaccination skepticism in Europe?
Absolutely, but this is nothing new. We had this with the measles. We know what to be done, to study the behavior, not to point fingers to the people, but we have to be, and we are in this office, very proactive to target which segments of the populations are hesitant, and then to adapt our approaches.
Dr. Hans Kluge, the World Health Organization's Regional Director for Europe, many thanks for your time.
My pleasure.
It's now time to give you a quick update on the coronavirus pandemic across the world. Officials in Indonesia say more than 350 vaccinated doctors have contracted Covid-19 and dozens have been hospitalized. Almost all were inoculated with China's Sinovac jab. German biomedical company CureVac has suffered a setback in its attempt to develop a vaccine. Interim testing data suggests the company's vaccine may only be 47% effective. Japan is easing a state of emergency in 9 areas, including Tokyo, as virus cases fall. Reports suggest the government might allow up to 10,000 spectators at the Olympics, which begins in 5 weeks.